Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, and as a part of the continuing medical education program, as well as as a part of the health awareness program for general public, I like to dwell into this topic today, that is the H3N2 virus. Now, which is at random, very many people are getting the viral fever. Now, H3N2 virus is a subtype of an influenza virus. It's just short-lived, and the symptoms when one gets it are the chills, coughing, fever, nausea, vomiting, throat ache, muscle body pain. Some of them get diarrhea, sneezing and running nose. So, these are some of the symptoms that you are getting the H3N2 virus, which include chills, coughing, fever, nausea, vomiting, sore throat, and muscle ache. Some people get diarrhea. Now, how do you treat it? It's just take complete bed rest, drink plenty of fluids because you have to hydrate yourself very well, and you can use antipyretics. Consult your physician, take antipyretics can be taken, and if essential, and if it is the doctor will decide whether you require any other medications. Otherwise, a complete bed rest with drinking of lots of fluids and hydrating yourself will do good. Now, how does one prevent it? More than treatment, we must think about the preventing this. Prevention is see that you avoid crowded places, at least for the time being for some time. Then wear a mask, wash your hands with soap and water, avoid close contact with sick individuals. I reinforce that you have to wear a mask, especially when you have a problem when you are sneezing or when somebody else has an issue also. Please do wear a mask, and do wear a surgical mask or a 3-layer mask, which is very important. The outer layer, the inner layer, as well as the outer, middle and inner layer, 3-layer mask. The outer layer will absorb the virus as such. The middle layer will filter all the unnecessary microns and viruses, and the inner layer will be what you can say will be totally protective, and what you can say your cough will fall on that. So, a 3-layer mask is very, very important. So, that's the best way to prevent it. Washing your hands with soap and water, avoid very close contact with sick individuals, cover your mouth and nose. Again, another very important is cover your mouth and nose, what you can say like this with the hand when you cough. When you cough in public places, better to cough what you can say as you are doing during COVID infection. Cough onto your elbow, what you can say, that's the best. And try not to shake hands with anybody, because the hands are the ones which the virus will be there, and invariably without your knowledge, you will rub it on your nose and the virus enters your nose and starts multiplying in the back of your throat and goes down to the base of the lungs and produce pneumonia and other aspects. So, let's be careful, and this extremely contagious virus spreads from one person to another is by coughing, sneezing or even talking to an infected individual. And thereafter, when you touch with that what you can say on your infected hand, on your nose or mouth, the virus actually automatically goes in. Elderly people, pregnant women and even children, be very, very careful, adopt these preventive measures, and then one need not fear about this H3N2 virus. That's in brief on the symptoms, what treatment you have got to give, and how to prevent H3N2 virus. Thank you very much.